I would like to take a few moments to instruct and review lifting and transferring techniques. Many of these scenarios are presented in a specialized setting, but please note that this information can be carried out in everyday situations. It is important to practice safe lifting techniques to ensure the safety of the child, as well as maintaining a healthy back. The use of correct body mechanics will help both the student and the provider safely complete transfers. I would like to first talk about proper lifting techniques and mechanics. It is important that we always consider how we are going to complete a lift. Questions you should ask yourself prior to attempting the lift are: how heavy is the object? What is the size of the object? Where am I taking it? Do I need help? Always use your larger muscles to complete the work of lifting. The large muscles of the legs are much more adept to handle the load of a lift when compared to the small muscles that surround the spine. It is also important to use a wide base of support. Consider the force placed on a pyramid versus a cone when pushed. The pyramid, with its sturdy stance, will barely budge, while the cone, with its narrow stance, will topple. These principles can be applied to the human body. Standing with your feet shoulder-width apart will increase your base of support, similar to that of a pyramid. Notice how Lita brings her body close to the box and widens her stance prior to lifting. She also keeps the object close to her to decrease the force placed on the small muscles of her back. In the second lift, Lita demonstrates poor technique. You can see the increased stress placed on her lower back with the box held away from her body. Lita also demonstrates the importance of stepping to the destination when performing a carry. By stepping closer to the destination, she keeps the object close to her body, thus keeping her larger leg muscles working and creating less stress on her back. Never twist when moving an object. While Lita demonstrates, you can see the stress put on her lower back. We understand that real-life situations don't always create an ideal lifting or transferring opportunity, but with a little planning, you can adjust your environment to complement safe lifting techniques. Let's talk about the techniques used while transferring a child. Lita assesses her situation, asking herself, how big is the child? What is her tone like? Children with high tone will be more rigid and do not bend easily or at all, while children with low tone will move easily and may be more difficult to control. These children will require a little extra support at the head and neck. She also considers any behavioral issues of the child, so she can remain prepared during the transfer. It is important to inform the child of your situation. During your preparation, be sure to let the child know that they will be moved. Always move the wheelchair close to the transfer destination and clear the path. Never forget to lock the brakes and always check to be sure they are secure. You should expect positioning straps throughout the wheelchair, which will need to be unfastened and placed out of the way. Lita positions herself close to the wheelchair, widens her stance, and bends her knees. She uses her legs to complete the lift and steps to the transfer surface. Lita uses her legs to lower the child and avoids putting stress on her back. Once the child is safely in place, Lita is then able to adjust the child's position using any special equipment she feels is appropriate or necessary. In our second scenario, Shannon assesses the situation and decides that she will need assistance transferring the student from her wheelchair to the mat. As Lita joins, they communicate how they will complete the transfer. Shannon will mobilize the child's heavier trunk, while Lita will mobilize the lighter legs. As they prepare the child for the transfer, they inform her that she will be moved from her wheelchair to the mat. They count to 3 to initiate the transfer. Both Shannon and Lita lift close to their bodies and with a wide base of support. Here is another example of a two-person lift with slightly different positioning. Again, you'll notice that both Shannon and Lita lift close to their bodies and with a wide base of support. It is important to check and recheck the child's position after a transfer. Smooth out wrinkles in clothing, fasten all safety equipment, and be sure there are no increased points of pressure. Ultimately, you should ask yourself, would I be comfortable in the same position? A dependent transfer is not needed for all children. Children that are able to stand with assistance may be best transferred with a stand and pivot. The same basic principles are used. As Shannon assists Lita for a pivot transfer, she positions her knees close to Lita's to block in case of buckling. Notice how Shannon guides Lita to pivot and does not push or pull to complete the transfer. By implementing these safe lifting techniques, you as a provider will decrease the likelihood of injury to yourself or the child. Always remember to assess your situation and please ask for assistance if needed.